Hello everyone, welcome back to my channel. My name is Dr. Sahara Omar. I am a licensed marriage and family therapist practicing here in the state of Texas. And today's video, it's continuation of the work that we're doing in this channel. I wanted to share with you guys how fragile our sanity is and how any one of us can easily break out of our sanity and go into a psychosis episode. And I wanted to also share with you guys ways that we can come back to our reality if we experience an episode of psychosis as well, okay? So before we jump into understanding our sanity, we first have to understand that our brain has two default methods. We can either stay in reality or we can either go into a fantasy space. The fantasy space is naturally developed when we are kiddos. You probably witness like yourself or other kids when they are playing house, for example, and they are chatting with their friends, right? There is this sense of like fantasy already exists with us, right? And one way that you can also look at it is because we're spiritual beings, that we have this accessibility to a spiritual space or a spiritual dimension. So that naturally creates this existence with fantasy that we could have as humans, okay? And then we have your normal reality, things that you can see and witness in your normal space, essentially, right? But if you've experienced certain experiences where you're breaking from reality, typically we first have to understand what's the root cause of it. What's that driving force that's pushing you to take a break from reality, okay? So the number one space that, at least in therapy, the number one thing that causes a break from reality is trauma. Trauma is anything that causes us too much stress, especially if it's physically, emotionally, sexually, or spiritually oriented, where the pain in itself from the trauma is so overbearing for us psychologically that the brain just says, I need to check out. And that checking out happens where we go into that fantasy space, okay? Other ways that can this happen essentially is also medication, especially prescribed medication like steroids. If you have a specific like allergy or eczema or anything like that, too much steroids sometimes can push us to have an experience where we are breaking from reality, or medication-induced psychosis. That's what we call it in psychology. And also within that medication, like prescribed medication, like even antipsychotic medication or antidepressant medication, or even Ritalin or Adderall for ADHD use, right? Like if we overuse or we don't follow the instruction of certain medication, we can also experience that break from reality. And then number 3, drugs in general, psychedelics, class 1 drugs like cocaine, heroin, methamphetamine, LSD, PCP, you name it, right? Marijuana, alcohol, all of those are ways that we can take break from reality. We're skipping over reality. Reality is overbearing. Or some people also do these drugs to experience the fantasy space because they don't allow themselves to dream or think outside of the box, right? So, or the pain that they experience from their traumas can be feeling like overwhelming to just be in their body. So sometimes we get enticed or tempted to try these drugs in general. And I wanted to leave with you guys this example. Literature also shows kiddos, people that are in their teens, that experience marijuana, like they smoke marijuana before age 17, they put themselves in a vulnerable position where they can experience psychosis like schizophrenia down the line when they are in their early 20s, mid-20s, when the onset of psychosis is schizophrenia is prone, essentially. So that's another way to keep reminding ourselves to not indulge in these drugs. And if you have, and you already know what that experience looks like, just come back, right? Like make that decision to not engage with these drugs. Other ways that we can also take break from reality is medical conditions, like Alzheimer's, Parkinson's disease, even vitamin deficiencies, some infections and hormone imbalances also can force us to take a break from reality because the body is not functioning, right? So remember, one way to stay in the reality is to be connected to your body, right? So if the body is not functioning well, the brain says, I can't be here anymore. I need to take a break. And that's when we go into the fantasy space, okay? And then sleep deprivation, if we're not getting enough sleep, right? So some people can also, sometimes the way they function and their lack of routine can only get like 2 or 3 hours a night, right? Like sleeping. If you have sleep issues, I highly recommend usually go to your medical provider, make sure that you are assessing if there's any other underlying conditions that's running that's leading you to not get enough sleep. But if we only get like 1 or 2 hours, we need minimum 6 hours a night. So if we're hitting less than 6 hours, we are naturally going to be overworking the brain, and the brain itself can also check itself out to say like, yep, this is too much, I need a break. That's when we go to the fantasy again. And then lastly, spiritual practices. Some spiritual practices can be traumatizing for the human body. This is linked back to the number 1 that I shared with you guys, but I wanted to also add it to number 6, because sometimes we are willingly, as humans, we make the mistake to go into spiritual practices that can force our body to experience that trauma, right? So stuff like getting branded, ritualistically being cut to bleed, for example, stuff like that is naturally, you can look at it and be like, yeah, those are just traumatic, but also as if it's falling under that spiritual practice, right? I've noticed like also some spiritual practices where people they get whipped, right? Like they get hit repeatedly over and over again as a form of devotion to God. No, that's not okay. That's just trauma, right? That's abuse to the body, and that can force your body to experience that break from reality, okay? So when clients come to therapy, the first thing that I do personally is I assess and help them understand what's the root cause of the psychosis, right? So are you experiencing a medical condition? Are you taking recreational drugs? Are you not sleeping well? Are you practicing spiritual practices? Have you experienced trauma, right? So we do something called intake, which is the first session where we ask a lot of these tough questions from the get-go, because it helps us understand what is causing you to take a break from reality. Some people, the psychosis itself is on a spectrum, meaning there is a minor version of it where we're just ruminating and thinking too much, and there's the extreme version of it where we're hearing voices and we are seeing things that it's not in reality, right? Like that's also the extreme end of the spectrum, right? So nevertheless, as I do the assessment in the beginning, I will also make a referral to allow them to connect to their medical provider, make sure that they're doing a blood test and any kind of test that they need to do, a lab test in general, to eliminate any underlying condition that could be possibly running in the family or running in their bloodline and they are experiencing themselves as well, okay? And then after that, we go into recognizing like, is there tools that are missing that we can just introduce to, or is it also rooted even more deeper, which is trauma? And then if it is, then we help them process the trauma as well, okay? So I wanted to leave with you guys that's psychosis, and I do want to also add any one of us can experience psychosis. It's not prone to a specific population or a specific group of people. Any one of us, our sanity is very extremely fragile. That's why we have to pay attention to what we do and engage with and make sure that we're not causing ourselves unwanted pain and align ourselves with healthy practices in general, okay? I do want to leave with you guys a tool just to help you guys also get started. And also I highly recommend get into therapy and also see your medical provider at least once a year to make sure that your labs are doing well and you're not experiencing any underlying conditions that can push you from a break from reality. And also hold yourself accountable as well if you are engaging in some of these dysfunctional activities as well, okay? So here's a tool. In therapy, we like this tool a lot. It's called the sensory techniques or 5-4-3-2-1 method, right? And it helps you just to be grounded, right? Another name for it we also use is called the grounding technique. And the point is to come back to reality, right? So when we experience major events and ways that we learn to disconnect from our reality needs to come back. We need to also make reality safe again, essentially. So we have to reintroduce ourselves to reality, okay? So this technique, the concept around it is you use your 5 senses essentially, because that's the best way you can come back to reality. You take a moment and either sit down on the ground, take a deep breath so that way you are connected to your body again, and then look around, name 5 things that you can see out loud. Make sure, and typically with this technique, when I do it with my clients, I ask them to say it out loud, right? Because we are reintroducing ourselves to reality. So 5 things that you can see around you, recognize their color and their patterns. 4 things that you can feel, and take a moment and touch those things, like if it's your clothes, your surface, your hair, right, even your skin. So that way you can allow yourself to be in touch with your touch sense, essentially. And then 3 things that you can hear. the ticking clock. So typically in my office, I have a ticking clock, distant traffic voices that you can hear, right? Of the traffic in general, your own voice, the voice of the person in front of you, right? Take a moment and just recognize what else are you hearing out loud, right? And then two things that you can smell, and then also take a moment to smell those things, right? Typically in my therapy room, like I would have like a gum, and I'll like a box of gum, and I ask my client to smell it for a second, or if they have like their coffee or they have a drink with them, I ask them to smell that, right? So just allowing yourself to engage with your senses again in that way. And then one thing that you can taste, right? So take a sip of your water or a mint or anything that has a flavor, like a taste to it, right? I had one client one time was like, oh, I can taste my own spit. And I was like, yep, that's one way to come back to reality as well too, okay? So the more you practice, it takes any techniques. I also wanted to leave this with you guys. Anytime you are practicing a new technique or a new tool that your therapist has introduced to you, or you're learning how to implement a routine for yourself, it takes on average 66 days, okay? So 2 months and 6 days before your brain can say, okay, I am back, or this makes sense to me, okay? So old neuroscience research used to say 21 days. We know now it's a little bit longer, okay? So give yourself daily practices where you are engaging with your senses. If your brain is drifting into the fantasy where you are thinking too much and you're worried about things that you have no control over, keep coming back to grounding yourself. And especially if you can add it to your calendar, practice the technique itself, like, oh, grounding technique for 15 minutes, right? So that way you can engage with your reality. And the more you do it, the more you will become connected to your body. And if we go even deeper than that, that's what you do outside of therapy room, right? So I teach it to my clients, and then when they leave, that's what you practice on your daily basis. But also the root of our traumas, right? So when we experience trauma and we break from reality, the brain wants to know, are you holding yourself accountable, or are you holding the other person accountable? And most people struggle with that balance, right? Like finding that balance between holding people accountable and feeling the anger and the frustration that's underlining the trauma, and also forgiveness, right? Like allowing yourself to experience that compassion towards yourself and other people. So that work also is necessary to process the trauma. Sometimes some of my clients would say, I've been trying this technique, the grounding technique, and it's not sticking. Well, sometimes it might not stick because you still have to talk through what happened and how do you view what happened to you, right? Are you blaming yourself? Are you blaming other people? And are you able to find that balance, okay? I hope this video helped. If it did, please hit the like button. Feel free to leave a comment, and also subscribe to the channel, and feel free to share the video with people. Thank you, everyone.